Hello and welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you but help you to move on to the brighter side of the health. Do you know what are the different types of physiotherapy? Yes, you are hearing it right. Physiotherapy also have different specialities and different domains. And based on these speciality and domains, there are different protocols that might be helpful for your condition. So, if you who are someone who is suffering from a problem that requires physiotherapy, you should hear this video out because you will understand what kind of physiotherapy you need for your problem. If you are interested in knowing this, make sure to watch this video till the end. Let's begin. So friends, physiotherapy has got majorly 5 core specialities. After completing our bachelor's in physiotherapy course, we do our master's in physiotherapy course. And in this master's, we pick our specialty. Very similar to the doctors after finishing their MBBS course choose a stream for their post-graduation. Some becomes orthopedicians, some become gynecologists, some become dermatologists, etc. Similarly, after completing our physiotherapy course, we choose our specialization. The major line of specialization that exists in physiotherapy is musculoskeletal physiotherapy, sports physiotherapy or sports rehabilitation physiotherapy, neurological physiotherapy, or else you can say physiotherapy in neurosciences, community rehab physiotherapy, cardiovascular physiotherapy, and pediatric physiotherapy. So these are the major common streams, but as the time is advancing, there are also subspecialties coming out. But the idea is that if a person is suffering from a neurological disorder, for example, stroke, paralysis, or any sort of central nervous system or nerve related issue, then neurological physiotherapy or physiotherapist would be able to help. So now let's dive deeper and understand what are these specialties and how they deal with the different problems. So let's first start with the most common vertical of physiotherapy that exists, and that is musculoskeletal rehabilitation physiotherapy. Now, as the name suggests, this stream of physiotherapy deal with musculoskeletal problem. So problem like your muscle ache, pain, bones and joint related issues. So if an individual has gone through an joint replacement surgery, if an individual has gone through a fracture and requires rehabilitation, if an individual suffer from musculoskeletal aches and pains like spondylosis, spondylolisthesis, or injuries like repetitive strain injury, etc., anything that deals with musculoskeletal system of the body, then the musculoskeletal physiotherapist would be the right person to go to. Similarly, if there is an individual who is an athlete, or else if you are a sports person, sportsman, and you are involved in playing athletic sports or professional sports, then you are prone to develop sports related injuries and you will go through a lot of sports related procedures or surgeries as well. At this time, you will also require physiotherapist help. And at this position, a sports physiotherapist would be your go-to person. A physiotherapist who is a sports physio usually do their masters in orthopedics and sports rehabilitation. This course is again done after completion of their bachelor's in physiotherapy, and thus they are very deeply involved in managing conditions that are related to sports injury. You will find these sports physiotherapists very specifically working with teams of professional sports players. They would be also working with individual sports personalities, helping them in rehabilitating, and at the same time they will also be involved with people who are involved in fitness based exercise regime. So this is the second most popular stream of physiotherapy that people know about. Now let me move on to a little more unknown stream of physiotherapy, and that is about community rehabilitation. Community rehabilitation physiotherapy is also in specialization of physiotherapy which is done after the completion of bachelor's of physiotherapy. Community-based physiotherapy basically focuses, as the name suggests, on working with people living in communities. Now, common challenges that is seen in masses is related to workplace injuries. So people working in ergonomic setup, people working in women's health space, people working with prenatal and postnatal care are the physios who usually do their masters in community rehab. In community rehab further, they can choose their electives or else their majors into ergonomics or else physiotherapy in obstetrics and gynecology. That's how physiotherapist helps in people suffering from different work related challenges or else people suffering from problem that is common in masses. That's where community-based rehabilitation comes into the picture. The fourth stream that I would like to talk about is neurological rehabilitation physiotherapy. Yes, people who suffer from injuries or else degeneration or else diseases that's related to your brain and spinal cord usually get their physiotherapy from neurophysiotherapists. Neurophysiotherapists do their masters in neurological rehabilitation and they help people suffering from various neuromuscular disorders or disorders that has involvement of neurological system or else your central nervous system. At the same time, it has an impact on their movements or musculoskeletal system. That's where neurophysiotherapists come into the picture. I am a neurophysiotherapist. That's why my specialization lies with working with people suffering from neurological disorders like facial paralysis, stroke, Parkinson's disease, multiple sclerosis, muscular dystrophy, etc. The another subspecialty that comes with neurological physiotherapy is pediatric physiotherapy. Yes, children who are born with musculoskeletal impairments like deformities, cerebral palsy, or else developmental disorder that will have an impact on their movements also require physiotherapy, and the kind of physiotherapists who work with them are called as pediatric physiotherapists. These physiotherapists usually have done their masters in neurosciences and they choose their elective as pediatric physiotherapy, and that's how they have deep knowledge, deep work done in pediatric space. So if your child is someone who is suffering from cerebral palsy, who was born with developmental deformities like scoliosis, torticollis, or else child is showing developmental delay due to which there are impairment in the movement, or child has gone through some severe head injuries, at that time pediatric physiotherapist would be the go-to person for you. And last but not the least, I would like to mention about cardiovascular physiotherapy. Yes, there's also a specialty in physiotherapy who are called as cardiovascular physiotherapists. They basically work, as the name suggests, with conditions like that's related to your cardiovascular system, which means your heart, your lungs, at the same time your blood vessels. If you have suffered from a cardiac arrest, a heart attack, or else if you have gone through some heart related surgeries, or else if you have developed a breathing related challenge like asthma or else bronchitis or even COVID in those terms, or else if you have developed some muscular challenges like varicose veins, deep vein thrombosis, etc., at that time also you will require physiotherapy and the cardiovascular physiotherapist will work with you. Under this domain, there are other specializations, subspecializations like oncological physiotherapy. Yes, there are physiotherapists who specifically work with cancer patients. If a cancer survivor going through a surgery, a procedure like chemotherapy or radiation will definitely suffer lot of health related challenges like chronic pain, chronic fatigue, adhesion, stiffness in the joints. At that time, the physiotherapist who is specialized in cancer care would be the go-to person for you. Similarly, the cardiovascular physiotherapists also work very deeply in ICU with post-op cases and critical patients who have compromised breathing and they have a very high risk of congestion or else development or accumulation of the fluids in lung. With the help of certain techniques like postural drainage and different drainage techniques, they help in removing the phlegm that is accumulated in the chest region. The another stream of physiotherapy that also exists is physiotherapy in biomechanics. Yes, this group of physiotherapists basically understands the mechanics of the body. They are deeply involved in the research and in the posture analysis and gait training. They use softwares which helps in doing the posture analysis, identify where all the body imbalances exist and focuses on posture correction or deformity management. Usually these physiotherapy streams are now upcoming, not very easily available, but there are physiotherapists who basically deeply work into biomechanics and kinesiology of the body. And these therapists help you to work on your posture correction. So friends, these were different specialities of physiotherapy that do exist. There are many subspecialties in these major ones. Like as I said, there are physiotherapists who are also now specializing in conditions like hemophilia management. Physiotherapist focuses on renal rehabilitation, pelvic floor rehabilitation, and many other conditions like that. The benefit of taking physiotherapy from a specialist therapist or else physiotherapist who has gained deep knowledge in a particular area is that your recovery process becomes more simplified, more streamlined, and more goal oriented. At HealthQ Rehab, we have a panel of expert physiotherapists to choose from based on your problem. All you need to do is go to www.healthqrehab.com, see the profiles of our therapists, and then try to take help based on your condition. I hope through this video you got an idea on the major areas of physiotherapy that we have got. On this next video, we would be also showing you how different specialty of physiotherapy can help you in solving your problems. So make sure to follow us and subscribe to HealthQ channel. On that note, I'll end this video here and see you in the next video.